My name is Jasper Goss. I'm the Projects Coordinator with PSI, Public Services International. We've been working on the Ebola issue since at least April 2014, when we first started receiving reports from our affiliates of health workers dying in Liberia. We were very concerned at the time because not only is it impossible to join a trade union in the public sector in Liberia, but these workers themselves had not been paid for months and their families were denied any kind of compensation once those workers died. It was also for us a warning sign, because when a health worker dies doing their job, it means there's something very wrong. Something is not working in the entire system. And unfortunately, our understanding was actually correct. It would be good not to be correct in a situation like this, but it turned out we were correct. We understood there was a grave threat, and then the Ebola crisis turned into the worst outbreak of Ebola in history. Thousands of people infected, more than 10,000 people died officially. But when we look at health workers and the impact on health workers, we see something like more than 600 health workers to date who have died from Ebola. And this is a real indictment in the fact that the health system, the health structures are not working. Workers can't do their job properly because they're actually dying from doing their job. So for us, the response requires a kind of quite a political response. It requires political decisions to change the nature of how we fund our health systems and to really rethink the idea that we can do things on the cheap, we can do things with contracted workers, we can do things through NGOs. We need strong, robust public health systems that governments support with proper training for workers, with proper investment in infrastructure, and with proper investment in equipment and proper ability to do their jobs. For us, from PSI, the job is not for us to kind of sit around and see how can we train more people. For us, it's about campaigning and lobbying and mobilizing and making unions stronger so they can make this demand. We want to mobilize our membership so that they can campaign, so that they can lobby governments, so that they can work not just at the national level, but also at the regional level through things like ECOWAS, the Economic Community of West African States, the Health Ministers Summit, the West African Health Organization. These are important regional bodies in Africa that can have a very significant impact on the way in which health systems can be rebuilt. For us, it's not just also about the Abuja Declaration, where we've said 15% of money should be spent on healthcare. You can spend a lot of money on your health system and get very poor results. It's very unfortunate that the United States spends huge amounts, far more than 15% of its national budget on health, and yet it doesn't get the results that are necessary because it doesn't have a strong public health system. So yes, we support the Abuja Declaration, we think that's a proper goal, but by itself it's not enough. We want to see investment in public infrastructure, we want to see investment in training, we want to see investment in staffing levels. By doing this, by working internationally, we think this is another arm, another way in which PSI can assist its affiliates in campaigning for proper health systems, public quality health systems. The other thing that's very important for us about Ebola is that what Ebola teaches us and has taught us is how underprepared we are. Now, we might find a vaccine for Ebola in the next period of time. It might come in 6 months, it might come in 2 years. But how do we know about the next type of Ebola, a different type of virus, MERS, for example, Middle Eastern Respiratory Syndrome, or any other kind of public health crisis? If our health system is not prepared, if they are not adequate to the task to deal with something like Ebola, then they're not going to be up to the task to deal with all of our other problems. This is why it's very important that we work internationally, because what Ebola shows us is that we're not prepared internationally to deal with the kind of problems that we have. We saw what happened when there was exposure in the United States. It's been a very, very instructive lesson there. The unions there were very concerned because what they saw was a vast difference between how well a private system could respond to a health crisis and a public system. In both, and this is very interesting, in both Nigeria and in the USA, in the places where there were strong and good relationships between the government and health workers' trade unions, and where the government was ready and where the unions were able to lobby, we had good results. In New York, strong, good trade unions, good relationships with the employer, a good role for a public health system. They were able to contain and treat Ebola effectively with no infections of health workers. And the same in Nigeria. They got an infection. There was a few small number of deaths. They are very tragic. We should not underestimate them. But because they had a good system of dialogue between trade unions and government, they were able to mobilize resources, and the unions were able to play an active role in the containment. This is the kind of model that we need to work on. There's a lot more to do. PSI believes that we can't just solve the problem technically. We can't just solve the problem by giving more training. It's a political issue, and it requires commitment from governments to negotiate and work with trade unions and solve these problems collaboratively rather than keeping trade unions off the table.